Did you know that almost all teeth in the back part of the mouth have grooves in them, little lines? Many of the grooves are defects, where the tooth structure has not developed properly. These grooves may or may not be open into the inside of the tooth. They collect food debris and are the starting point for dental decay. The extracted tooth shows leakage and decay, which obtained access through the groove into the inside of the tooth. If the grooves are detected at the right time, which is soon after the tooth erupts into the child's mouth, they may be sealed with plastic material, a sealant, preventing decay from starting. However, the sealants must be placed at the correct time in relation to the eruption of the tooth. If they're not, the decay has already started. The chewing surfaces of the back teeth have sharp projections on them called cusps to allow effective chewing. Their characteristics are similar to mountains with valleys in between. During tooth development, as the steep cusps reach one another, the outside tooth substance, enamel, should fuse or join with the adjacent cusp. If this does not occur, a groove or a fissure occurs. 3 types of grooves are shown. As you can see, one of them is not open to the inside of the tooth. The second one is like a cul-de-sac or an opening into the tooth without penetrating. But the third one has full opening into the inside of the tooth. The microscopic image of the tooth cut in half shows a deep groove that would probably become decayed soon after the tooth erupts. Various types of plastic materials are used to fill the defective grooves before they become decayed, and they don't damage the teeth. These materials are called sealants. The sealant materials may be tooth-colored, or they could be slightly off tooth-colored to allow observation when evaluating them after service in the mouth. When should sealants be placed? Teeth erupt into the mouth at predictable times. The first permanent molars erupt at about age 6, and the second permanent molars erupt at about age 12. These are the teeth that usually have the most defective grooves. The smaller back teeth, called premolars, are not as prone to have grooves in them. It's desirable to seal teeth within 6 months after they have erupted into the mouth. Some dentists also seal baby teeth or deciduous teeth. Ask your dentist about this concept. This image shows teeth in several stages of eruption into the mouth. The upper left and right images show teeth that have not erupted enough for ease of placing sealants. You can see that the gum tissue covers them. The lower left image shows a tooth that has erupted enough for proper placement of a sealant. It's just right. However, the lower right image shows a tooth that has already had decay start, and a typical filling should be placed instead of a sealant. Dentists or hygienists cannot always tell if a tooth should have a sealant. Various techniques, including electronic devices, assist in predicting the presence of decay. Therefore, it's much better to seal any highly grooved tooth as a preventive procedure. You will be informed by your dentist or hygienist about the most appropriate time for sealants to be placed. Waiting too long allows decay to form in the grooves, and typical sealants cannot be accomplished. Is it difficult to place a sealant? No. Without any anesthetic, the tooth is cleaned. Various isolation techniques can be used, such as the gray rubber dam you see in these images. However, cotton or other drying aids are also used. A mild acid material makes the groove area microscopically rough, so it will retain the plastic without conventional cutting of the tooth structure as you might do into the filling. The plastic is applied and hardened, and the sealant is completed. Are there alternatives for sealants? At this time, your 2 choices are either to place the sealants at the appropriate time or wait and see if the teeth do become decayed. I don't like that second choice. If the teeth do become decayed, silver or tooth-colored fillings or restorations must be placed, requiring cutting away of decay and a little bit of the adjacent tooth structure. Fillings cost significantly more than sealants. Waiting is not a good idea. It has been estimated that about 1/2 of the molar teeth, the very back teeth, that erupt into the mouth of a child will become decayed if the many grooves on the top surfaces of the teeth are not sealed. You're observing the mouth of a late teenager with a rubber shield over his teeth. He has had to have silver fillings in many of the grooves in his teeth. Tooth-colored fillings could have been placed instead of silver. If sealants had been placed soon after tooth eruption, it's unlikely that these fillings would have been necessary. When tooth decay is detected early, very small fillings may be accomplished, removing only a slight amount of tooth structure in addition to the decay. In spite of them being small, the cost of these fillings is still several times the cost of sealants. The very small amount of decay in this tooth could have been removed conservatively, but a sealant would have prevented the decay if it had been placed a few years previously. When your dentist places typical silver or tooth-colored fillings, a significant amount of tooth structure must be removed, as you see in the left image. The finished tooth-colored fillings are shown on the right image. Although they are beautiful and relatively strong, sealants would have prevented the need for removal of much of that tooth structure, the weakening of the teeth, and the additional cost. Do sealants last forever? The arrows on the image indicate the presence of tooth-colored sealant in the grooves of the tooth. Over a period of years, the thin and potentially fragile edges of the sealants can wear or break off, requiring replacement or repair of the plastic material. Your dentist or hygienist will advise you of the need for this simple service. Sealants placed properly in the grooves of teeth within a few months after a tooth is erupted are a significant, proven preventive oral health measure. They reduce the incidence of dental decay, they reduce the cost of oral care over the patient's lifetime, and they preserve sound tooth structure and tooth strength. Your dentist or dental hygienist will answer further questions about sealants.